Hello, I'm Dr. Robert LaBelle, and today we're going to be discussing knee pain. Knee pain is a common condition that occurs to humans, partly due in fact that we walk. And as we walk, the knee is a load-bearing joint, and as time, it will invariably break down. Very common conditions that occur in the knee are knee tendonitis, an IT band syndrome, and a quadriceps tendonitis. Knee pain is common, partly due in fact due to low back stiffness and hip stiffness. As the low back and hip develop stiffness, particularly in the glutes and the lateral hip, the IT band will invariably become tight. And typically what that will do is it'll actually pull the kneecap laterally, and the majority of people call that a patellar tracking disorder. As the kneecap tracks laterally, what eventually ends up happening is we end up getting a tendonitis to the infrapatellar tendon, which is centrally located, or the medial retinaculum, or the quadriceps tendon. Treatment of knee pain is quite similar to the hip. We eventually will start with releasing the knee with different techniques such as active release. Some of that might look very similar to this. We would work on the IT band, releasing the IT band as well, and we would move all the way up the leg as well as releasing the hip. We may eventually use a Graston tool. Graston is a state-of-the-art tool that will help break down scar tissue. That similarly looks like active release, where we just end up releasing the tissue. Both techniques are aimed at rebuilding the soft tissue, regenerating the collagen, which will eventually replace the older damaged tissue with new healthy tissue. Along with the release, the patient will be shown some hip strengthening procedures, which will help stabilize the leg, and as well hip flexibility procedures and leg flexibility stretches as well. If the patient is still experiencing knee pain, very often what we might do is we might move to the foot and assess the foot structure. Occasionally pronation or supination of the foot, flat-footedness or high arches will eventually cause dysfunction leading up the leg, causing the knee pain. So that's something that has to be looked at if knee pain is not resolving with the traditional treatment to the local area in the knee.